Welcome back. Thank you so much for joining us. As we mentioned earlier, we are here with a panel of local experts, and we have a lot of ground to cover, guys, so let's go ahead and get straight to it. I want to go ahead and open up this question to everyone first. Looking back, at what point during the pandemic did you start to think things are getting serious? This is now turning serious, possibly even deadly. Open to anyone.
For me, it was as soon as we saw our hospitals being significantly impacted, and we knew we had to do something to ensure that our residents had access to a good level of care should they need it.
Did it get serious for anyone else here?
Yep.
So, go ahead.
Well, yeah, for me, it was when in-person instruction stopped, and we immediately moved to distance learning. I think at that point, things got really real.
Yeah, Dr. Cothran.
So we noticed a similar effect in July and August is when we started seeing a surge in our patients in our hospitals. Our ICU started to reach maximum capacity, us having to surge out to other departments. So that's when it became really serious for us.
As a doctor, were you concerned about the unknown of this virus?
Absolutely, and I think that's the thing that scares us the most, is the unknown aspect of it. So I think all of us were extremely fearful of what this virus was, what it could do, and as we well know, what it has done for all of us.
And Ryan, for the county.
To your question, I think there were a series of moments for me, not just in the beginning, but all the way up until just the last few months. A variety of different events, state directives, schools closing down, stay-at-home orders, businesses being shut down, kids not getting back to school. Many pivots, changes of direction, hospitalizations fluctuating up and down. So a number of different things that have, at different points, were concerning.
And Jesse, I want to get back to you in education. As a teacher, what change have you seen in your students and their parents throughout this whole year?
Yeah, well, I think when it first began, the transition from in-person instruction to distance learning was really abrupt, and teachers had to completely change the way they did things on a dime. There wasn't really a whole lot of opportunity to kind of test things out. So that was very difficult. What we've noticed, what we've tried to kind of figure out over this period of time is, how do we do distance learning in a way that is conducive to learning? How do you engage students online? When they're in the classroom, being able to teach in the classroom, there's a certain way to do that. It's completely different online. And being able to engage students who are at their various homes with technology issues, with issues in regards to needing assistance, not having it at home, most likely, is difficult. So I think trying to overcome all those technological difficulties, as well as the engagement issues, and as well as the equity issues that also really surfaced over the course of the pandemic.
Yeah, and talking about equity, we talk a lot about the students, but the parents too, making it work for their students. What have you seen change for parents?
Yeah, absolutely. I think the parents being able to, having their students online, and then them themselves often having to be online. I mean, if you look with our teachers, we have a lot of our teachers who were having their students in one room, their kids in one room online doing distance learning, and they're in another room trying to conduct class. So it made it really, really difficult for I'm assuming for parents who were at home. But also, with the issue with the kids not being able to go to school, having to be at home, creating a lot of daycare issues. So that as well made a tremendous burden on parents in the household.
And this question open for anyone here. Do you think this last year will have lasting impacts on our education, businesses, the community as a whole? If so, what do you think it'll impact?
I think it's going to impact everything. We have a lot of cleanup to do following this pandemic. We've been locked in our houses for the past year. And in Kern County, we've already struggled with chronic disease. So I can only imagine how that has worsened over this past year, as we haven't been outside, we haven't been exercising, we haven't been going about our regular lives. So we're going to have a lot of cleanup to do following the pandemic.
Absolutely, Brent, I agree.
Yeah, I think the biggest tragedy the past 12 months has been the lives we've lost, right? We peaked over 1,000 lives due to the virus, but we've lost lives due to mental health issues related to the exercise that we've been in through this pandemic. And it's affected our children, it's affected their parents, it's affected people just holding on, trying to make ends meet. And, however, you've got kids that have been many of them in our community have been out of school. Online learning, as was said, is not the same as being in the classroom. They've been out of school for a year. Their lives have been changed in a permanent way, missing a year of school. Essentially, of real school. You've had the business community, small businesses struggling to make ends meet. They just don't snap back. They've had 12 months of suffering and trying to survive, trying to pay bills, trying to pay creditors, etc. So this isn't going to be just a snap back to normal. I think that the effects of this, I fear, are going to be felt for some time to come, and I'm not sure how long that's going to be. I hope it's not long, but I think we're going to be seeing the effects for quite a while.
So, Dr. Cothery, do you think the medical field is going to be forever changed?
We've already seen the changes. There's several things. We've learned that we can surge out to different departments. We can house ICU patients in other floors. We can cross-train nurses, ICU nurses to be surgical nurses, or surgical nurses to be ICU nurses, vice versa. So we've seen a lot of that. We've seen our communities come together, all the hospitals in our community. We consider ourselves somewhat competitive, but during this time we did form there was a sense of collaboration. So we did come together in that. Even in the outpatient world, we've seen virtual visits now really take a rise. So, I think medicine, and I think like my colleague said, everything has changed.
And we know that
continue to change.
Yeah, and we know a lot of different things have come down from the CDC, a lot of guidelines. Did you agree with a lot of the guidelines that were set and came down from the CDC?
Well, I think, there was a lot of stuff that came down that contradicted itself. And I think part of the reason is we were still learning about the virus. We still don't know a lot about this virus, and we still continue to learn. So I think there was a lot of confusion. We told people don't wear cloth masks, and we said wear cloth masks. And we said don't double mask. Now we're saying wear double mask. So there's a lot of things going on because this is a dynamic time. And I think it will continue to change. The more we learn about this virus, the more guidelines will come out to keep us safe. And that's what they're doing, is keeping us safe.
So people need to be able to adapt. They need to be able to understand that things are changing, we're still learning, and just be adaptable.
And that's the one thing I think that we've all learned through all of this, is you have to be able to adapt because things are so dynamic.
One thing I did want to include in regards to adolescent mental health, adolescent mental health has always been an issue, and we've never really had the resources in our schools in order to be able to deal with it. I think the pandemic exacerbated the adolescent mental health, but my hope would be that mental health, now that people are talking about it, people actually start doing something about it, and we start to get some resources in our schools to actually deal with it. Because like here in Kern County, adolescent mental health is hard to find, and a lot of times these teenagers end up having to go either into the children's mental health or into adult mental health, which is not adolescent mental health. I mean, their brains are very different. So I would hope that now that people are talking about it, that some real change comes about because of it.
And it continues to become a conversation. Yes, absolutely. Bryn, I want to ask you this question. By the way, congratulations on your new position. Congratulations.
Thank you.
I know I've seen you out at the fairgrounds a lot. I want to ask you, what steps do you think leadership needs to take to get the county back on track to a sense of normalcy? What's next?
So we're already taking those steps. We've seen nothing but great leadership happening in our community. Dr. Cothery mentioned really the hospitals coming together to decide how we can best serve our community as a whole. We've been doing that as a county, leadership coming together. How do we get together and provide vaccination in the most efficient, effective way possible that our community can access in that way? We need to continue those efforts. We have a lot of cleanup to do following the pandemic. That leadership needs to continue on so that we ensure that we get our community back to a healthy place.
Absolutely. Ryan, I want to open up the same question to you. What do you think leadership needs to do to continue? As Bryn said, we're already on that path. What do you think we need to do to continue to get back to that normalcy and get everything back to being reopened?
I think we need to continue to stay agile and be flexible to pivot to the changing needs associated with a pandemic that continually change, as Dr. Cothry pointed out. Been a lot of changes over the last 12 months. We're focused on vaccine capacity right now and maintaining that capacity. We've got the capacity right now to do just under 60,000 doses for residents every single week in this community. We need the supply. It's all about the supply chain, and we're pleased with the progress. Supply seems to be ticking up with each and every week, but we're focused right now on vaccination distribution. And that's where we're going to be until there's a need to pivot again, likely in the near future.
And open to either one of you guys, when do you think we're going to reach a level finally when you say, okay, we've gotten enough people vaccinated in our community, we're starting to get over the hump? When do you think we're going to reach that threshold?
So it's absolutely dependent on the supply that we receive from the state. If our supply levels continue as they are, we're hopeful that by the end of the summer that we'll have enough people vaccinated that we can get back to some sort of normalcy. But again, that's completely dependent on the level of vaccine that we receive.
And speaking of the state, Ryan, I do want to ask you, you've been a huge critic of the state. What are some of the things you think they should have done differently throughout this pandemic?
You know, our criticism came at different times throughout the past 12 months. Granted, this is an unprecedented event, right? There's no playbook on it. And so the governor has done, I think, the best job that he felt he could do in the leadership position that he has for a pretty big state, right? We're a huge state. The consistency, the transparency, the information, right, that was associated with the various directives and guidelines that were handed down at different times, the changes. I think, you know, whether you're a business or you're in education or any other sector of the economy impacted by the directives of the state, there was a lot of frustration in how those were communicated out, how those were decided on. At times we felt like the state didn't work very closely with counties in figuring out how they wanted to proceed.
Do you think that's changed now?
I think that it has changed. There's always room for improvement. I think there's still room for improvement. There's a lot that the state's not telling us still to this day. There's a lag in information that we provide to the state and information that they provide to us, and so there's always room for improvement on every side. But I think our frustration really, and our Board of Supervisors' frustration, has been really on behalf of the people most affected by these shutdown orders over the period of time that they have been in effect. And really it's been about the clarity of the message, the consistency of the message, and really trying to figure out how the decisions were getting made, because at times, again, the state was not working with counties, and some of the people in the business communities felt like they weren't being heard either. So the frustration that I had was a reflection of the frustration of our Board of Supervisors, and I think the frustration of our community.
Do you think we're finally coming full circle though now? Do you think the communication is getting better, or do you still think we have a lot of work to do in order to get that connect back with the state? I think
the communication's better than it has been at any time in the past. Again, there's always room for improvement. This is still a very fluid situation. There's a lot happening. I'm sure the state's going to be making changes going forward. I could surmise that changes will be made within the various tiers that they're shifting counties through. We're getting ready to go into the red tier. Right now, that means a certain thing for certain businesses in terms of opening. That could change. We could see the state making changes within the tier system going forward. So we hope that if that is going to be the case, that there is great thought put in it, that they work closely with the counties, they work with the business community to make sure that we all understand what's happening and we're all on board with those changes.
And Dr. Cothry, I want to ask you, he just mentioned the tier system. We could be moving into the red tier. I know that's something that everyone's talking about. But as we get closer to that, or we get excited for that, what should people keep in mind as we're starting to get over the hump? We are starting to get people vaccinated. From a health perspective, what should people still be doing to protect themselves and their families?
You know, I think we've been talking about this from day one. You know, keep your hands washed. social distance, right? That's been the big one.
So just because you're getting vaccinated, that doesn't mean all the things that we've been taught are going out the window.
Absolutely. And the reason for that, ideally, is because these vaccines are fantastic vaccines that are out right now, but they're not 100%. We also have these variants now that we're dealing with. We don't know what that's going to do, for the people that have been vaccinated. And I think the other big thing is masking. I think, you look around, this is the lowest I've ever seen flu cases. I've been practicing 20 years. I've never seen flu cases this low. Common colds have kind of gone by the wayside. So masking, social distancing, hand washing, these general techniques do help, not only with this virus, but with other viruses, other bacteria as well, other little pathogens.
I think a question that a lot of people have are masks here to stay? Is this going to be a common practice now?
You know what? I think if the mask mandate is lifted, I think you'll see certain industries, including the healthcare system, keep them. It's definitely helping us out. We've not only are we protecting ourselves from our patients, but we're protecting them from us as well. So I think in certain industries, you'll see them staying forever.
And Jesse, I want to ask you before we wrap up here, what's your hope for your students as we get through the pandemic? What do you hope to see next year, next graduation?
Well, hopefully we get back into in-person instruction in a safe manner, and there's no yo-yo effect. So once we get back into the classroom, we stay in the classroom. And I also like to see some of the technology that we've learned how to utilize over the course of this pandemic continue to be utilized in some way. In-person instruction is by far the best way to teach students, but I do think that the technology that we've learned how to use can be applied as well. And for the most part, I'm hoping that our students kind of what they get out of this is how to work together to meet a goal, because I think that's what this called for. I think regrettably the pandemic became politicized, and the whole notion of even wearing a mask became questionable, and lots of people weren't doing their part, and I think that just made it harder. I think we could have been through this a lot quicker had we all worked together. And the same thing, with going back to in-person instruction. I think, had we all worked together, not just as school districts or as a state, but also as communities, and done the right thing, we could have been through this a lot quicker than we have been. And my hope is that that message comes through, that our students stay safe, that their families stay safe, and that we're stronger for it as we move forward.
Absolutely. And last question, main goal of the county, what's next? What are the top things on your list?
For the public health department?
Public health, yeah.
Definitely to start addressing those public health issues that we were trying to address before we even went into the pandemic, and that is hunger within Kern County. We see Bakersfield as one of the hungriest metropolitan areas in the nation, even though we produce the most agriculture in the nation. We have high STD rates, we have high chronic disease rates. So getting back to the programs that were addressing those before we went into the pandemic, and likely that those issues have been even worsened over this time period, are definitely the things that we're going to address as we come out of it.
Perfect, thank you. And Ryan, for the county, what's your goal? What's the end goal here as we're starting to get through the pandemic? What do you hope to see change immediately? What's the immediate goals you're trying to achieve?
I think our economy needs to get back open. I think our schools need to be back, or our kids need to be back in school, in the classroom, across all school districts immediately. And my job as the CAO is to support Ms. Kerrigan and the Public Health Department to make sure that they have everything that they need to be effective, to make sure that we're doing everything we can to support Dr. Cothry and his colleagues in all of our 10 hospitals and the medical system, to make sure that all of that's working correctly, so that we continue to stay concerned and aware of hospital capacity, ICU capacity. That's from day one always been our biggest concern. But at the end of the day, if we can get back to more normal times, I look forward to working with the Board of Supervisors to improve the quality of life for residents who live in this county.
Couldn't agree more. I hope we all get there, and I know we will all get there. Thank you guys so much for your time. We truly appreciate it. And that's going to do it for us. Again, we just want to remind everyone who is watching this, we hear you, we see you, we know we still have a very long way to go, but we are getting there. There is light at the end of this tunnel, and we will come out of the other side better for it. Thank you for watching us. We'll see you right back here at 11. Have a good night.